Hi, it's Dr. Valerie Sutherland with your daily dose of hope on weight and metabolism. Today, I'd like to talk a little bit about what is obesity medicine. My primary specialty is internal medicine, so I did my internship, residency, and my initial board certification in that specialty. Many people are familiar with internal medicine. We generally manage chronic disease in adults. So our job is to diagnose and manage diabetes, high blood pressure, cholesterol, asthma, all of the common diseases that happen. But what I found was that many of these conditions had an underlying root cause in overweight and obesity. And what people and my patients really wanted was to get healthier and to have the diseases go away rather than to have them managed with medications or with medical equipment. But unfortunately, in my traditional training of residency, internship, and experience, I didn't really get training on how to actually treat the disease of overweight and obesity. When you look at medical education, even today, which is a little bit past when I had it, very little time is devoted to weight loss or weight management. So I went out on my own and got a secondary board certification in the specialty of obesity medicine. And this is an emerging specialty. There are specialties today that didn't exist, 20 years ago. Things like even emergency medicine didn't used to be its own specialty, or sports medicine didn't used to be its own specialty. So it's kind of analogous to that, where we see, okay, here's an area that we need more specialized care because we need to provide a higher level of care, or there's a gap there in traditional healthcare. So there's about a few thousand diplomats of the American Board of Obesity Medicine in the United States and Canada, and those are physicians who have done that extra training on top of their primary board certification on how to treat the disease of overweight and obesity. This is important to know because many people need to advocate to get care for the disease of excess weight. It was designated as a disease in 2012 by the American Medical Association, and there are FDA-approved medications, there is evidence-based treatment guidelines, there's bariatric surgery, and studies show that only 1% of the people who would benefit from a treatment are receiving a treatment. And many times it's because maybe they haven't been offered the treatment or counseled on the treatment or don't have access to the treatment. So we have excess weight as the leading cause of preventable death in the country. We have only 1% of people who would benefit from treatment actually getting treatment. And then we have traditional education and training of our healthcare providers that doesn't focus a lot of time on providing that training on how to provide that treatment. There may be other factors involved too, like weight stigma, weight bias, and those are additional factors that we can discuss at another time. But for all these combined factors, many times people are not getting the treatment that's available for the diseases of overweight and obesity and really are being treated for the complications of the underlying disease. So I'd encourage you to seek out a medical professional that has education and training on the disease of obesity, much like you would if you had any other medical condition. So I encourage you to compare how that's treated to any other disease. So if a person had a cardiac disease, they would have a cardiologist. Or if they had an endocrine disease, they would have an endocrinologist. So of course, excess weight is a spectrum of disease, but if your health is not where it should be, then a physician that has specialized training would be a next step. So if you need to find one, there's an Obesity Medicine Association, and they have a website, and there is a provider finder directory in there. And so that is a good place where you can put in your zip code and find a specialist trained in your area. And you can look at their primary certification and at their experience and find a good match. But remember that overweight and obesity is a disease. In my practice, when I see a person, my job is to find out what things are contributing to the disease, to engage the individual in joint medical decision making based on their values and goals, to have a treatment plan, and then to work and follow with that person long term to reassess the response, the tolerability, and then adjust the treatment plan over the long term. Because just like with any other condition, when the disease is not well controlled, there's more intervention, and then the goal is to get things in remission and then to observe, and at the first sign of any sort of relapse, to intervene and get things back under control. So it's really a long-term therapeutic relationship, just like with any other medical specialist for treating any other disease. And that is something that is generally not present in the traditional healthcare system for various reasons. And so make sure you advocate for yourself and find a physician that has that education and training so that you can be part of that 1%, and hopefully we can expand access and treatment and improve this epidemic. So thank you for watching and stay tuned.